Thank you, Annette, for a nice introduction and all of you for joining us today. Before I go to my slide, I would like to declare that I do not have conflict of interest. So today I'm going to talk about why Doxy PEP should be standard of care for people living with HIV and PrEP users. The reason is the increasing rate of STI in worldwide. This is a global map. The WHO estimates of more than 374 million of new curable STI in each year. And data from US and many countries that have good reporting systems show the worrisome rise in gonorrhea, chlamydia, and syphilis. For Thailand, there is an increasing trend of all bacterial STI over the past 7 years. And according to the syphilis rate of infection, with the limited resources, syphilis testing is only bacterial STI screening countrywide. In this slide, I show you the epidemic of STI among MSM. On gonorrhea, you will see that gonorrhea infection is most common in MSM more than heterosexual males and heterosexual females. And this is occur in the same thing in syphilis. For chlamydia, you will see that women is more common than male, but substantial impact on MSMs. In Thailand, we also have problem in high burden of bacterial STI among young MSM and transgender women. When you look on table 1, you will see that there is increasing of prevalence of any STI among people who less than 24 years old. And chlamydia infection is the most common infection in any age groups. Another data also show the high subsequent and recurrent STI prevalence among newly diagnosed HIV-positive Thai MSM and transgender women. So all the data show you that there is a linkage between STI, HIV, and MSM. To ending HIV or AIDS is challenging if STI burden is still high. MSM with a bacterial STI are at greater risk for acquiring HIV. There are many strategies in the past that we implement, such as condom use, counseling, screening. Right now, we need something new, better strategy for STI prevention. So, why doxycycline? Because doxycycline is safe, well-tolerated, and inexpensive. It active against chlamydia and syphilis infection, but gonorrhea will depend on antimicrobial resistant data in each country. When we talk about doxycycline post-exposure prophylaxis, there are 3 important studies that I would like to refer. This is Hypogate DoxyVax from France that enroll MSM on HIV PrEP, and also Doxy PEP study in Seattle and San Francisco that enroll MSM and transgender women that taking HIV PrEP, and also MSM and transgender women that living with HIV. Participants were enrolled and randomized according to their protocol and divided to be 2 groups, Doxy PEP and no Doxy PEP intervention. The arm that received Doxy PEP will get doxycycline 200 mg as taken a part of post-exposure prophylaxis within 24 hours to 72 hours. If they have condomless sexual contact. And then they test for gonorrhea, chlamydia, and syphilis. The results from all the studies show the relative risk reduction is between 47 to 66%. And it appears that doxycycline can reduce all bacterial STI. How about safety and tolerability? You will see that there is 1 case of grade 2 transaminitis and low number of adverse events. Most of them are GI effects, and very few number of discontinuation of these studies. In conclusion, Doxy PEP works well to prevent bacterial STI in certain MSM and transgender women, regardless of HIV status. who are at high risk of repeat infection and need to treat 5 people to prevent an STI in a quarter. In high STI incident, that is study from Doxy PEP, and doxycycline is safe and well tolerated. So why not we moving forward with Doxy PEP? Thank you.